Thank you very much for joining this session. This is the second cross-city engagement session. We have a very heavyweight panel here coming from 4 different cities or countries. And we will have about 1 hour's time. So we are a bit late. But anyway, each of the speakers will have 8 minutes. So I will only make a very short introduction of each speaker, okay? The first speaker would be Dr. Han. Dr. Han is the Director of Research Institute of Science for the Better Living of the Elderly. She herself is also a board member of the Korean Gerontological Society and also Korean Family Welfare Society and senior led in the United States. And she has developed many new innovative programs, including those involving ICT, information and communication technology, and also some other programs related to age-friendly city and people with dementia. So we will now invite Dr. Han to share with us. Dr. Han, please. You can speak over there? Yeah. Okay. Testing. Okay.
Yes. Good afternoon, everybody. Yeah, I am from Korea, in the Asian country. Yeah. So the aging issue is the big issue in Asia too. The ASEAN country or the East and the North Asian, everywhere the aging issue is the big issues. So Korea is also the very important issue in this year, the aging, because population of aging is the new challenge. So 30 years ago, 20 years ago, 10 years ago, it was okay. But right now, this is very serious. The reason is the too many older people in our community. So comparing the European country and the Asian country, the European country, the aging issue is the very prepared, the aging issue and the national strategy something. But in the Asian country is a big problem because we do not have any preparations. So this is the new challenge for our community. So my research institute always talking about how can make the innovative strategy for older people. So most people talking about innovations only for the engineer or a scientist. But our institute, the direction is for older people. How can promoting our older people and how can challenge for our older people. So we have lots of the developing programs and the ICT and also the innovative area. So, for example, recently we have taught how can using the computer and the smartphone, but from this year we changed it. We are more promoting the programs. How can connecting the AI program and also the IoT program and also how can using the smart equipment. So it is very difficult for older people, but we are just developing how can the implant for our older people to using to understand. So we are the promotion to change the community, showing how can the best practice and how can the role models for our older people. So we are showing the role models, the innovative our older people, then the community is getting changed little by little. So this time I made the delegations with the scholar, also the older people. So some older people are the patient show here. So I saw them, it must be changed our older people. They are very healthy and they are very good activities. So our society must be changed. The thinking about the aging is too bad, aging is nothing. New change. Old is a new young, and also aging is not too bad. So we show we promote our older people, the aging is not too bad. Because, think about the artist is getting older, and then the engineering also getting older. Most people are getting older. So we must developing the new change, new strategy is very important. So I really want to emphasize let's change the new aging. So without our thought is not changed, we cannot solve any programs in the aging issues. So aging is not too bad. Aging is showing the contribution our society, and also our older people can change our society. That is very important. So I will talk more about the technology and the innovation way in the discussion set because of my short speech times. Okay, thank you very much.
Thank you very much, Dr. Han. So Dr. Han has shared with us about their mission is to promote change among elderly people, and the concept that old age is not too bad. I think it's not bad at all, and especially if we have so many organizations promoting ICT, the use of AI and IoT programs. Of course, it's not easy. It is also challenging to me, as I'm not so old, but I don't know how to use it. So I will hear how Dr. Han said her program in the discussion time. So the next speaker would be Dr. Ogawa-san. Ogawa-san is the president of Asian Aging Business Center and also the founder of Active Aging Consortium in Asia Pacific. Ogawa-san, he's very concerned about how to prevent the health deterioration. So he has some program about preventive long-term care promotion. And he also works with the government. Say, for example, he is a committee member on the Social Welfare Council in the Kumamoto Prefecture, right?
Yeah.
So the time is yours, and thank you.
Good afternoon, everybody. And I will talk maybe the preventive long-term care. It's a very good programs because nowadays almost the people can live longer. Yeah, and in Japan already centenarian is 6,000-7,000 people enjoy their long-term life. Yeah, but it's need to keep healthy life. We don't take care the long life expectancy, but we emphasize healthy life expectancy. It's need not to get long-term care. How to realize this kind of new lifestyle? It's need we must prepare the later life with a healthy body conditions. It depends on our lifestyle. If you sit down too long, it's not so good for our healthy lifestyle. Please, you stand up. Yeah? Every time we should stand up. At that time, we take care of this one. Yeah? Squat. This kind of a squat is a very good lifestyle. It's a very strong, our bodies, strengthen our bodies. And please sit down. Yeah. And also, we must laugh. Silent is not so good lifestyles for the healthy. Yeah? And also, we think about many things and exercise our bodies. Every time we work in brains and bodies. This is good for preventive dementia. Without these kind of activities, brain tired, body tired. We cannot stand up. And also, we lost this kind of muscle and the bones strength. We get whole. Almost a long-term care patient is injured. They cannot rise up no more. How to prevent this kind of a condition? Then Japanese society discovered this kind of a syndrome. We say locomotive syndrome. When we cannot exercise, my body will be decreased, and we cannot maintain the balance, and fall, and injure, and go to the bed, and the bed didn't life. It's not so happy life. Then we must exercise in every day. Yeah? This is one leg stand and squat. Yeah? And walking and laughing and talking with each other. This kind of a healthy lifestyle, please employ in your life. It's a preparing the long-term care. Yeah, we need not some kind of the support, no more. Yeah, we must maintain this kind of lifestyle. Yeah, this is my message.
Thank you very much, OGAWA-san. It's a very short but very powerful message, you know. I have to practice the exercise now. And it's not easy to talk and I will do exercise, right? It's very hard, actually. So, come back here. The next speaker, the third one, the first speaker comes from Indonesia. He's Dr. Budi RAHARDJO. So Budi, she is the professor of gerontology and the director of Center for Aging Studies at the University Indonesia. And she was also an honorary visiting professor at Oxford University, the Oxford Institute of Population Aging, and also a member of the Active Aging Consortium Asia Pacific. So Budi, your time.
Thank you, Mr. Chairman. First of all, I would like to give my great appreciation to Dr. Rebecca and all the team with the very successful in conducting Golden Age Expo and Summit. Big applause to the committee. Thank you very much for inviting us. The first impression when I came here in this building is that so many participants are older people, and they are very, very healthy. That's the first thing that I was really impressed. The second impression is when we came here from the hotel, the driver is Indonesian Chinese from Indonesia. He is 82 years old. He is very, very healthy because the program and the support of the Hong Kong government to the older people is very, very significant according to him. He mentioned that every year, 2.5, is that right? 2.5 million Hong Kong dollars given to the older people here for healthy lifestyle. Big applause again to Hong Kong government. The comparison between Indonesia and Hong Kong, that Indonesia is very large. Indonesia is very big population with 270 million people. And about 10% of them are older people. Here in Hong Kong, I think, maybe small, but also the population of aging population is quite high. But here in Hong Kong, you stay in a very high buildings, while we in Indonesia live in a rural and small cities. That's why I would like to concern on how to conduct healthy aging in small cities and villages. Indonesia, because most of the older people stay in rural area, in villages, nowadays, their young generation support the older people to take care of the older people in healthy aging, active aging, and also long-term care. The point is that they do by themselves, they do as a volunteer, and the government only give very small support. That's why in Indonesia, we do everything by ourselves. And I hope that will be continued because in this case, we were and we was supervised by Dr. Takeo, Dr. Donghee, Thelma, and others, and also Catherine from ICAP. The other thing that we also concern in dementia, I would like Professor Hogervos to stand up. We do collaboration with the UK, with Professor Hogervos, in how to prevent dementia. We start with research, and based on that research, we do such program how to prevent with, for example, exercise, healthy food, and so on and so on. And nowadays, we are also developing active aging, especially relating to the prevention of dementia. Again, my appreciation to Hong Kong, my appreciation to ACAP, and my appreciation to older people all over the world and Hong Kong. Thank you very much. Hopefully, we come back again. Thank you.
Thank you very much, Budi. I think we are having speakers from with very different perspective and very different programs. So we can discuss about this in our discussion session. So the last speaker is my old friend, Thelma.
Friend of long standing.
Right, friend of long standing. I think we know each other back in the last century, because Thelma has been with the SCAP for quite a long time, and I think it's about 1990s. We invited Thelma to be our consultant and conducted a study about social development in Hong Kong. Yeah, am I right? I think it's about that time, right? Yes. And Thelma, she has been with the UN SCAP, the Economic and Social Commission for Asia and Pacific, for quite some time. She was the former chief of the Social Development Division. And she is also a senior advisor to the Singapore government in terms of aging issues for the Ministry of Social and Family Development. And also, Thelma is the advisor and consultant to many different countries and governments. So Thelma will talk more about the policy side of active aging or long-term care. So your time, Thelma.
Thank you very much for this kind introduction. Okay. A friend of mine said, don't refer to anybody as your old friend. Say he's a friend of long standing. Actually, that advice came from the well-known Professor Tommy Koh, who is very respected in our region. Okay, but let me move on. I only have 8 minutes. Aging is a very important issue, becoming very important in this region. I think aging has come in waves in our region, starting with the first wave of Japan, Korea, my own country, Singapore, Hong Kong, Taiwan. We were the pioneers, the first wave. And then there are other countries coming along behind us, Thailand, Indonesia, Vietnam. All these are aging very rapidly. And then a few are not aging that rapidly, but some of them have very big populations like India, very big in numbers. So we have a problem here region-wide. But, and most of us have, but I want to actually focus on Singapore and Hong Kong, because I think many of you must have been to Singapore. We have a very low fertility rate of 1.2, but our life expectancy is one of the highest in the world. We also have very small household size, and I think something that we have in common, we have a lot of scattered families, people who have migrated or are not living in Singapore, living abroad. Another interesting thing is that 90% of our population live in high-rise, of which 82% are in public housing. So this is a very important statistics when we come to talk about aging in place. But only 0.3% of our population, 65 plus, are in institutional care. For us, institutional care is of the last resort. I think for many of you, it's the same. All right. Now, I need to talk about policy, but I give you the brief background first. A recent study in Singapore was very disconcerting because it showed that while our life expectancy was increasing, in fact, men was 2.9, women 2.5, but the healthy life expectancy that my friend Dr. OGAWA spoke about was not keeping pace with the life expectancy. Our healthy life expectancy from 2005 to 2015, over 10 years, was only 1.7 years. So in other words, our people are getting older, but not getting any healthier. So longer periods of periods where you are not healthy. What does that mean? It means you have to think about income security, what do they live on, that's longevity. But you also must think of the greater health costs, the greater long-term care costs. So from that then, we have a lot of policies. You know, Singapore is quite good for policies and planning and all that. So I want to share with you a few of these. I know within 8 minutes, just very quickly. First of all, I must focus on active aging, because our active aging policy is not just physical activity. It's a more holistic one based on the WHO 3 pillars of participation, human security, and health. So this is a very holistic picture. But I think knowing Singapore, you know, things have to be put into action. So with regard to being productive and all that, we have, of course, increased the retirement age. But it's not just a matter of just shifting the age. You have to have a lot of structures to help you to be able to work longer, retire. So we have a lot of things on like skills training, even a task, even a special institution to look after this kind of for extending retirement age, and then we also have working on the employers for the buy-in. Because you can have all the laws in the world, but if your employers continue to not buy in, and we also have anti-discriminatory laws. So in other words, you can talk about extending retirement, but you need the infrastructure to back you up. Similarly, for active aging, for all this healthy aging, the whole idea is, as Dr. OGAWA again, is preventive long-term care, so that we can stay healthy, so that we do not need so much long-term care. So having said that, I think another important policy point is that we are beginning to face the whole issue of the politics of aging. This may sound, most of us talk about health, but there is a political aspect of aging. This is, we are reaching a stage where we are having I wouldn't call a conflict, but a discussion on who pays. Who pays? Is it the taxpayers, meaning the younger generation, or do we dig into our savings? Singapore is quite rich, so we have savings, but even then, that is not sustainable. So we are reaching a stage where we look at intergenerational relations, not in terms of just, of course it's good to have a social relation, in terms of the politics of it, the economics of it. And then again, on the politics of aging again, who does the caring? Who does the caring? We have something called many helping hands. In other words, everybody is supposed to do it. But when you did the survey, they found that only 2 were the main parties. One was the family, of course. The other one, surprise, surprise, was the government. So the community didn't even come in. It's just a recent thing. So we have to make a lot of effort now to have community-based activities. So this is the politics of aging. And lastly, I think very importantly, and I think something we have in common is that we try to leverage on our culture. So we have, of course, filial piety, and all of you know what it's all about. But we also have something interesting called social piety, meaning that we have to thank our older generation for building up Singapore. So for that, people over a certain age, myself included, have certain privileges. You know, we have medical subsidies and all kinds of things. And here we find that our younger generation do not quite mind that. You know, they say, okay, you know, you oldies, you build up the country. But now they're asking, what about us? When we grow old, do we get that too? So that is an issue. But it also means that it's possible to build upon these cultural aspects. And of course, Hong Kong and us, we build upon our culture to look at better nutrition, exercise, a lot of Tai Chi classes going on now. And I just saw a stand on something called Pak Kwa. Some of my friends are doing it now. So I think we can also continue to leverage on that. And then, of course, we have finally something that I think not all of you will agree with. It's called the Maintenance of Parent Act, which means that you can sue your parents if they don't support you. Now, this is actually, it sounds terrible. I'm asked about that everywhere I go. But actually, in practice, it is really just for sibling equity. All the family gets together and decides whether, you know, who pays what for daddy and mommy. But what my point was that we try to leverage on our cultural heritage. So these are the 3 main points. Of course, we are having other sessions, but I think my 8 minutes is more than up. Thank you.
Thank you very much, Thelma. Thank you. Please have a seat. Yeah. So Thelma shared with us about some of the policies and also politics of aging in Singapore. So we will still have like 30 minutes time for discussion. I think I can say maybe I ask 1 or 2 questions at the beginning, and then leave more time for the audience, for all of you to raise your questions or your comments or share your experience, okay? So the first question, maybe I ask Dr. Han first, because Dr. Han, at her presentation at the end, she mentioned about some projects related to technology that she would like to share during the discussion session. Maybe you can have some time to share that part, okay?
Okay. And in fact, in 5:30, the technology sessions, I will talk about the technology more, but I would like to talk about how can share the tech and aging. Yeah, your question is right. Okay.
You want to share now a bit?
No.
Or you will share at the other session?
Yeah.
Okay.
Yeah.
Okay. Thank you. And so how about, because you mentioned about the use of AI and IoT, and I'm not sure if, can you tell us more about in what aspects do you AI or IoT in promoting, say, healthy or active aging?
Okay.
Yeah.
And 10 years ago, usually I just presentation about cyber family or cyber neighbors, how can teaching the computer for older person. But now, absolutely the industry format and the technology is changed. So the fourth industry revolutions made us absolutely changed the aging and tech. So the mostly AI and the IoT and then big data is developed in a lot of the scientists. So that is the connecting with our older people, how can the better life for later life. So for example, in Korean, the Samsung smartphone, here is the voice services. When I need some call to my friend, I just say, my friend name, and then this is the show me the number very easily. So mostly our older people cannot using the smartphone. So such the system, the helping the older people. And also the AI is a very good thing. The correcting a lot of the data, the lipologs for older people, and then disease, and then the activities, and then this is correcting the data by the AI. So we are correcting how can promoting the everyday daily life for older people. We can apply this kind of data. And then the much easier services for our older people. So our gerontologists developing how can moving our older people, we are making the life log. And then one person, when he wake up, and then the whole day, the lifestyle, so that we can develop such things there. This is very useful for our people understanding. And this is for the nursing home and then every community, even the family. So this is a very good the technology. And also the IoT is every, the things is with the connecting with the technology. So very easily, the helping support the older people life. But important thing is how can the education and the training for our older people. Most, the engineer and the scientists are thinking about the technology, not for our older people. So we must talking about the gerontologists and the engineering and the scientists to work together, because our gerontologists know our older people. That's why this is the connecting is very important, I think.
I see.
Yeah.
Thank you very much. Thank you. So we are talking about two very different dimensions. So in Korea, Dr. Han talking about how to teach older people use of, say, technology, smartphone, the power of AI and so on. But our two other friends from Japan and from Indonesia, you're talking about teaching people to exercise, to laugh. So it's back to basics. I would like to ask both of you, OGAWA-san and also Budi, can you share with us, do you, through your preventive program, have you recorded some significant changes? Say, for example, the rate of fall, whether there's a significant decrease, or whether the healthy and happy old life, this kind of situation. Do you see any significant improvement after you promote this program? Yeah.
Yes, and the preventive long-term care is two approaches. One is a population approach. A population approach is that all of the people can't participate in these programs, and they can maintain their healthy life. That without the exercise, we lost our powers of bones and muscle. Then it's a maintain oriented one. Another approach is high risk target one. It's once they get injured, and after that remedied by the hospital cares, and go back to home. But if there is no rehabilitation training, they much worse conditions. Then it needs some kind of rehabilitation programs. This is a high risk target approaches, and high risk based on the high risk target. There are a lot of the evidences. Without trainings, their condition will be decreased. And now we focus on the population approach. Everyone live in everyday life. They adopt the healthy lifestyle. It's a big challenge. Without this kind of lifestyle, we get very severe long-term care or not. This is a very, very longitudinal experiment. Then we started. And in Japan, and we get evidence and experience and analyze them. And Fukuoka City make medical data and long-term care data conjunct and integrated database and analyze them, and we get some good knowledge. It's maybe in near futures we can evaluate this kind of a result. And also, now I transferred these kind of programs to the Bangkok and making some trials and comparing with these kind of different database, and we get some evidence of these trials. This is my programs, yes.
Okay, so both types of program, both target groups, very specialized, specific target groups, and also population based. Okay, and then you have some kind of database or analysis to capture the changes.
That's true.
Very good, very good. How about you, Budi?
Thank you. In Indonesia, we have 34 provinces, and most of the older people stay at home. We have a program called family-based services conducted by the cadres, or it's called caregivers, but especially the caregivers are the family members. Our concern on healthy aging and active aging, we adopted the 7 dimensions of active aging from International Council of Active Aging. The first one is spiritual. The second one is intellectual. The third is emotional. The fourth is physical. The fifth is social. The sixth is vocational. And the seventh is environment. We did research already, and we found that the one with the high spiritual life, the quality of life is high. The one with good emotional life, the quality of life is high. The one who are still engaged in social activities, the quality of life is high. And the one who are still work, the quality of life is high. And also, last but not least, the physical, condition, that good physical condition with good attitude, with good behavior, health behavior, the quality of life is also high. But unfortunately, we still weak in the environment. There are 2 kinds of environment, social environment and physical environment. Our social environment is good. That's why if we talk about active aging index, according to Professor Hogerfors, the active aging index in Indonesia, relatively low, but in terms of social engagement and also social support, is part of the environment is quite good. That's the one that we have conducted in 34 provinces. Thank you.
Thank you very much. Thank you. And then I have a question for Thelma, but before I ask, I would like to see if anyone from the audience, whether you would like to raise any question. Anyone? Yes, Rebecca. Good. 有冇咪啊? Do you have a mic? Yeah. So I'll come back to ask Thelma later.
Thank you. Thank you, speakers. Very informative, and you have let us know about the developments in your various countries. So this morning we had the international panel, and then the speaker from England told us that they are facing strong depression among the elderly. So that's why they have developed the social finance to tackle this. So from my limited knowledge of Korea and Japan, sometimes we learned from the newspaper that suicidal rate among the elderly is rather strong in these 2 countries. Can you let us know how is the situation now? And if that is the case, what have you done to tackle this so that we can also learn from you? Thank you.
Okay, thank you, Rebecca. And the depression issue is very important. And also our Korean, the OECD tell the highest the elderly suicide rate is Korea. So we are very worried about these situations because our older people are very isolated in the community. That's why our research institute is developing the narrative equipment. So we developing the narrative, the training, the groups, and then we are talking with our older people, the person by person. So the narrative, the trainer talking always to our older people, who you are and why you come here and what you have done in life, your life cycle. And then continually talk and talk. So they made the shape and sometimes very the old history about the people. So the trainer visited the hospital and the community, and then we made a lot of the visitor trainer programs, and then they give the chance talking with the older people. So this is the new challenge about the narrative equipment. And also nowadays we are helping how can the evidence with this equipment is very useful. So we are the test the 1 year, 2 year. It is very good improvement because our older people in the hospital or the living alone, our older people do not say anything. Even people come, they do not talk. So the narrative equipment, the trainer, made speak and the narrative the way. So this is very useful in Korea. Yeah. And also another one is the government is set every community and promoting the preventions, depression and the suicide. So we call that clinic in the community center, so that they give a lot of the programs for older people. Yeah, thank you.
Yeah, in Japan also a very severe problems of suicide of older persons, and almost of causes is social isolation, and if there is many human, but they have no good relationships, they fall in social isolations, and how to prevent these kind of difficulties? It's need to develop the good place for the older persons and good status for the older persons. And this is a new programs for activate older persons. If they get up early mornings, they have some kind of a plan to go to anywhere, yeah, and they can meet with some friends or good persons and conversation. This kind of a program is very important for the prevent social isolations. Then now Japanese governments and also non-profit organization make this kind of places, good places for the older persons. This is a new programs now, yes.
Thank you. Any more questions from the floor? Then maybe I can ask Thelma a question, because you mentioned about that the life expectancy in Singapore is longer now, but the people are not really getting healthier.
Yeah.
I don't know if there's any analysis why this happened. It's because of the social policies, because of or various economic social problems, or do you have other explanation why the people are not getting healthier?
Well, they haven't gone into in-depth analysis. In fact, this is from the statistics, which has alarmed people a lot. is a very recent seminar. This was revealed. So I think the medical people are trying to look at the causes for it. Whether it's caused by chronic diseases, what has brought this about. But also the social people are looking at it. They're looking at like cases of suicide and things like that. So it's still a work in progress because we just woke up to this very important statistic.
I see. Then I have another question. You mentioned about the percentage of elderly people living in institutes. You talk about a very low percentage, like 0. something.
0.3.
0.3. So I think it is maybe the lowest among developed economies. On the other hand, Hong Kong, we have perhaps the highest. Because in terms of those, when you say 0.3, what's the age? Age 65 or above?
65 plus, yeah. Sorry.
65 plus. You guess how the percentage of in Hong Kong? We have close to 7%. So it's very high, 65 plus. So quite a lot of people live in this kind of aged home. Of course, not every people are so frail that they need a institutional care. It's sometimes a housing issue. So among these 7%, maybe 2% or 2 plus, because they don't have their own house. Unlike Singapore, you have like 80% living in public housing.
Right.
But Hong Kong, we face this problem.
Yeah.
But still, I would like to know, when you say that actually older people are not really getting healthier. And so if they stay at home, who take care of these people? Is there a very extensive, and you mentioned about that the community actually does not come in. So I would like to know more why you can, achieve such a low rate of institutionalization.
First of all, as you said, it is the housing problem because in Singapore, we have a very high percentage who have their own housing. Plus, the government also provides special rental places for those who are quite destitute. Very, very minimal rental. So housing, you cannot use the fact that you have no home to stay to go to a nursing home. Yeah. So that is one issue. On why. I think one of the reasons, and here my friends from Singapore, from Hong Kong probably can agree with me, is that we have a very high percentage of foreign domestic workers. Foreign domestic workers that our other friends from Japan, from Korea, that their foreign workers only go to institutions. Ours can be home-based. And in fact, I have some very shocking statistics which shows that you and I, Hong Kong and Singapore, in terms of ratio of foreign domestic and care holders to households, Singapore is one foreign domestic worker to 5.1 households. Hong Kong, you are almost just as bad, 1 to 7.5. So we have a very, let's say, on the other hand, Japan is like 1 to, goodness knows, 4,000 something. It's a very high number. The closest to us is actually Taiwan, 1 to 36.5. So this is, in a way, not the entire reason, but one of the reasons why our elderly can stay at home, why they don't have to go to nursing homes. Not the only reason, but a very important reason.
Thank you, Thelma. So let me see if we have more questions. I get a notice that we have 2 more minutes. But actually, we started this session quite late, almost 10 minutes late. So if we have more questions, maybe we can have, a little bit more time, okay? And anyway, let's see if we have any questions from the floor, or do we have any questions from the speakers you would like to share, or ask questions, ask others any questions? Do you have any questions?
I would like to know the more Hong Kong situations.
Hong Kong, okay. What do you want to know?
And just who care about older people, and then how about if older people want to walk, or how kind of systems they support the older people, something like that.
Okay, well, very briefly, Hong Kong, as Thelma said, we have quite a large number of foreign domestic helpers. So nowadays we have like more than 300,000 foreign domestic helpers. You know, Hong Kong, we have a population of 7 million, about 2.5 million households. And we have more than 300,000 domestic helpers, foreign domestic helpers. That's why she said it's a very high percentage in Hong Kong. And these foreign domestic helpers, more than half of them actually are taking care of elderly people. So the other maybe 30-40% are taking care of young children. So we really rely very much on foreign domestic helper to take care of elderly people. On the other hand, quite a high percentage, 7%, live in institutes. So it's, you know, comparatively, it seems that Hong Kong family, Hong Kong is a Chinese society. So traditionally, elderly people are taken care of by their families. But in Hong Kong, I think it's very complicated. Hong Kong people work very, very long hours. And we have a lot of elderly people living alone. So long hours will prevent the children to take care of their elderly, old parents. On the other hand, the house are very, very small in Hong Kong. So it's not easy for 2 or 3 generations to live together. So very often the older persons will live alone. So we have like 30 to 40% of elderly people living alone, either by themselves or only with their spouse. So it's a singleton, one person elderly or 2 elderly people living together. It accounts for like 40% of all elderly people. So you can see that if they really need some kind of assistance, if they are frail, then they might not be able to, get support from the family. And the last resort, they will go to the institutions. And then in terms of like working, actually the percentage of employment is not so high among elderly people. And well, of course, in these years, we see more elderly people, more retirees coming back to work. And we, of course, we know that they would not prefer working full-time. They hope to find some part-time job so that they can, have something to do and at the same time earn some money. But another issue would be the employers in Hong Kong. Employers, they would prefer hiring full-time staff, not so many part-time staff. So it's not always so easy. But of course, at the end, when the employers, they cannot hire enough employees, they will still consider this older one and doing part-time. So I think in the future, when we see now we have 16% people being elderly. So in like 20, 30 years ago, we were 30%. And then the working population will actually shrink. And so in the future, I think we will have more elderly people, or those who are older, say 60 plus or 65 plus, more will be working. And maybe we will also try more program to promote this kind of employment. And I can talk about something else, but well, maybe we can discuss. You can share.
May I have one question about that, about the domestic, what do you call it? Domestic caregivers or domestic
helper, foreign domestic helper,
yeah.
right?
Are they trained? Are they
right.
trained as a proper training for caring of older people, especially long-term care? That's
This
the one
is a very good question. Because actually, when I read your biography, I noticed that you have this kind of program. So I think we can learn from you. Actually, our government just start to do this kind of training this year. So we will start something. In the past 2-3 years, I think there has been some discussion. So we will start this program maybe your experience we can learn from that. Yeah.
Plus, we have a lot of those programs.
Oh, good.
Yeah,
Very
yeah,
good.
But there's also incentives to go with it. You know, the government gives grants and subsidies to allow foreign domestic workers to, and they're also trained in other skills, just so that when they go home, they can make a living. Yeah.
Oh, very good. Actually, there is a social enterprise in Hong Kong who, they arrange trained foreign domestic helper to come to Hong Kong to take care of elderly people. So they have been here for, say, 3 years maybe. But I think we should do more training ourselves locally, so that these more than 100 or maybe 150,000 caregivers, they will be well trained to take care of elderly people with different needs. Yeah. So I think we are almost end of the discussion. I just want to see if we have, say, one more question from the floor. If you would like to ask one more question. So one more. Good, very good. 有一位嘅問題係啦。So the last question, and then we will end this discussion. If possible, please introduce yourself. Thank you.
Sorry, my name is Mabel Lee, and I'm very concerned about elderly services. My question is almost the same as the last floor question. I would like you to share with us what kind of programs you have in your country about dementia, to help dementia people or to prevent dementia, because it's getting very serious in Hong Kong.
Thank you very much, Mabel. Thank you. So you want to share?
Yeah. And in Japan, now in Fukuoka City's case, and we now disseminate the humanitude method of the dementia care. It's a don't access from the background, yeah? Every time we access this kind of front, and slowly, don't grab the arm above. This kind of under the hands on, and speak slowly. Don't deny the word. Every time positive word. This kind of attitude is a very good for the dementia patient. And the dementia patient falling some kind of feeling loss and angry and loud. But this kind of our attitudes, very, very good result for calming the attitudes. This kind of knowledge and skills is very important. Then we disseminate this kind of humanitude method in the citizens and every caregivers and care workers. This is one case here.
Would others like to share any specific programs for dementia people?
Yes. And the dementia patient, you must know that the dementia patient is a cognitive is a problem, but the others is okay. So the dementia patient feels something and then touching something. So we must make the dementia friendly environment is very important. So in Korea, our government from this year, the government will be responsible the whole dementia patient. So we will give a lot of chance to not isolated our dementia patient. So just before I talk about the narrative equipment is one way to talk about make the conversations with the dementia patients. So when the dementia patient very aggressive because they don't know themselves what happened and what is going on. That's why they are very aggressive. That's why we just helping the dementia patient is the very friendly for them. It is very important, I think. Yeah.
Thank you.
May I add something
Sure.
that relate to the prevention? So after we do research with Professor Hogerfors, we found that Hopkins verbal learning test is quite significant. It's quite good instrument to recognize dementia or cognitive declining. Therefore, the first thing that we do is to give training to the caregivers and also the family how to recognize dementia or cognitive declining, because so many people cannot recognize whether someone dementia or not. That's why in terms of prevention, starting with conducting such training, that's the one that we do.
I see.
Professor Hogerfors, would you like to add something? Because I learned from her, because even she is very young, much younger than me.
Thank you very much, Professor Tribudi. Of course, Tribudi is my senior, and she has always trained me and mentored me. What is good about this particular test is it also identifies improvement. So we found that on this test, the people who exercise, do strength exercises and physical exercises, they improve, even if they have dementia. And also if they keep active, reading, writing, engaging in community activities, even if people have dementia, it's very important. And it doesn't matter so much what you do, as long as you enjoy it and you engage in activities. That's very important.
Thank you very much.
Just one last word
Sure.
on this. The next session, there's a session on physical and mental health. So more will be taken up on dementia in those sessions. But essentially, just very briefly, in Singapore, we are very good at making plans. So we have a community health master plan in which dementia is there. And we are also beginning to have dementia-friendly communities, a whole program centered on the community of identifying, of responding, of community care. So yes, you are right, the questioner, this is a very, very serious issue. And we really have to take concerted action. So come to the next session.
Thank you very much.